Breaking the silence around breast cancer. Why North African women are diagnosed late and what silence actually costs. Breast cancer is the most diagnosed cancer among women in North Africa. I do not say that lightly because behind that sentence there are women who noticed something was wrong and waited months before seeing a doctor, women who felt a lump, saw a change in their body, or carried fear they could not name and said nothing. Not because they did not care about their lives, not because they were careless, but because in many of our society, silence has often felt safer than the alternative. My name is Maha Jouini. I'm the founder of CHIFAA. I'm an AI governance expert and a breast cancer survivor. I created this podcast because I believe that improving women's health in our region does not begin only with medicine. And it certainly does not begin only with technology. It begins with honesty. It begins with naming what women live through, what they postpone, what they hide, and what that silence costs. So, in this first episode, I want us to begin there with the silence around breast cancer in North Africa and why breaking that silence is not symbolic. It's a matter of survival. Let me begin with the facts, because the scale of this issue matters. Breast cancer is the leading cancer diagnosed in women in North Africa. It represents the single greatest cancer burden among women across the entire region. Across the wider Middle East and North Africa, it counts for roughly 1 in 4 new female cancer cases and remains one of the leading causes of cancer-related death among women. In countries such as Tunisia, Morocco, Algeria, Libya, and Egypt, breast cancer consistently ranks as the number 1 cancer affecting women. But what makes our region's situations particularly urgent is not just how common it is how it's being diagnosed and at what age. In Western countries, breast cancer is largely a disease of older women. In North Africa, that picture looks very different. Between 50 and 60% of breast cancer cases in our region are diagnosed in women under the age of 50. That means young women in their 30s and 40s, like me, women who are raising children, building careers, caring for aging parents, women who did not expect to be sick, and the numbers are rising. North Africa and the Middle East are seeing rapid increases in both new diagnoses and death linked to breast cancer. Libya, specifically, has shown some of the most alarming trends. An acceleration in cases and death that researchers describe as deeply concerned. The contributing factors are documented. Obesity, delayed first pregnancies, reduced physical activity, changing lifestyles across the generation. They are all linked to raising risk, and North Africa's data on breast cancer is now considered among the most comprehensive on the entire continent, which means we can no longer say we do not know the scale of what we are facing. Then there is a cervical cancer, a disease that does not get spoken about nearly enough in our region, and that deserves to be named clearly here. Cervical cancer, سرطان عنق الرحم, is caused by the human papillomavirus, HPV, and here is the important thing to understand. It is a disease that can be prevented through vaccination, through regular screening. The science exists, the tools exist, and yet across North Africa, screening rates remain critically low. Women are not being tested. Cases are being found late at advanced stages when treatment is far more difficult and outcomes far worse than they need to be. Cervical cancer rates in North Africa are lower than in sub-Saharan Africa, but that does not mean the situation is acceptable. It means women are still dying from a cancer that, with the right systems and the right access, does not have to kill them. Across both cancers, the pattern is the same. Too many women reaching care only after the disease has already progressed. Too many women diagnosed at stage 3 or stage 4, when treatment becomes more complex, more exhausting, more expensive, and much more likely to reshape the entire course of their lives. And this is where I want to be very clear. Late diagnosis is not only a medical problem. It is not only about hospitals or machines or screen campaigns. It is also about women are taught to minimize what they are afraid to disclose, and what our social and health systems still do not make safe enough to say out loud. What does silence look like in practice? A woman notices something, a lump, a change in the skin, pain she cannot explain, a feeling that something is not right. But her first response is not always to call a doctor. Her first response is often to wait, to tell herself it is probably nothing, to hope it will disappear, to decide she will deal with it next month, after the family visit, after the exams, after the salary comes, after Ramadan, after the Eid, after the wedding, after she has finished taking care of everyone else. Then comes the second layer of silence, the fear of what happens if she says it aloud. If I tell my family, they will panic. If I go to the hospital, people will know. If I say the word cancer, everything in the house will change. My children will be frightened. My husband may not know how to handle it. My mother will collapse from worry. Maybe it is better to wait a little longer. So she waits 1 month, 2 months, 6 months, sometimes more. And that waiting has consequences. Breast cancer found early is far more treatable than breast cancer found late. When the disease is detected before it has spread, treatment options are broader and outcomes are significantly better. The same is true for cervical cancer. When caught early through routine screen, it is one of the most preventable cancer deaths there is. But when women arrive at care only at an advanced stage, treatment becomes harder, longer, more expensive, and far more likely to change everything about how a woman lives her life. That is what silence can cost. It can cost time. It can cost options. At some times, it can cost survival itself. Now, I want to be careful here, because it would be easy and unfair to say that women stay silent simply because they are afraid. Fear is part of it, yes, but silence is often a rational response to an environment that has not made speaking safe enough. The first reason is stigma. In many North African communities, cancer still carries layers of shame, pity, superstitions, and social fear. A diagnosis can become more than a medical fact. It can become a label. A woman may fear being seen as weak, damaged, or tragic. She may fear that illness will alter how people see her body, her femininity, her marriage, her role in the family, or even her worth. The second reason is family dynamics. Women in my region are often expected to be the caregivers first and patients second or third or never. They are the ones who manage the household, remember everyone's appointments, care for the children, support parents, hold emotional crises together, and keep life moving. To become the one who needs help instead of the one who gives it can feel unbearable. Not because women are unwilling to receive care, but because they have been taught for years, for decades, for ages, that their own needs must come last. The third reason is the structure of healthcare itself. In many parts of North Africa, oncology services are concentrated in major cities. Public systems can be overburdened, waiting times can be long, referral pathways can be confusing, transport is expensive, privacy is not always guaranteed. And for women already frightened, entering a health system that feels rushed, under-resourced, or emotionally cold can be enough to delay the decision to go. And then there is the fourth reason, the one I think about most. No one told many of these women that they are allowed to prioritize their own survival. No one said clearly enough, your body belongs to you. Your pain matters before it becomes unbearable. You do not have to earn the right to seek care. You do not have to wait until everyone else is comfortable with your illness before you act on it. When I talk about breaking the silence, I'm not only talking about awareness campaigns, I'm not only talking about pink ribbons in October or a celebrity speaking publicly about her diagnosis. Those things have value, but they are not enough. Breaking the silence means changing what happens in the private spaces where women making decisions. It means the conversation a woman has with herself at 2 in the morning when she feels something in her breast and it is trying to decide whether she is allowed to be worried. It means the conversation between a daughter and her mother, between a woman and her husband, between a patient and a doctor, between a survivor and another woman who has not yet gone to get checked. Breaking the silence means building systems that meet women where they are, in their own language, with their fears acknowledged, with dignity protected, without judgment and without forcing them to navigate terror alone. This is part of what CHIFAA is trying to do. CHIFAA is an AI companion being designed for women in North Africa living with breast and cervical cancer and other chronic illness. Not because AI can replace a doctor or a nurse or a community, it cannot. And not because the chatbot can solve structural failures in healthcare, it cannot do that either. But because there is a space between silence and formal care where many women are left completely alone. At 2 a.m., when fear is loudest, when a question feels too small to call the clinic and too urgent to ignore, when shame and uncertainty are pushing a woman back into silence, there should be something there, something that says, I hear you. This symptom matters. Hear what you need to know. Here is how to ask for help. Here is how to prepare for that appointment. Here is how to speak about what you are feeling without apologizing for it. This is not the whole solution to late diagnosis, but it is part of one, because breaking silence is not only about speaking, it is about building conditions in which speaking becomes possible. If you are listening to this and you are carrying something you have not told anyone, a symptom, a fear, a change in your body that you have explaining away, I want to say this clearly. You are allowed to know. You are allowed to ask. You are allowed to seek care before things get worse. You are allowed to put your survival first. And if you are listening as a daughter, as a sister, a husband, a friend, or a colleague, then I want to leave you with this. The silence around the breast cancer is not only held by the woman who is sick, it is also held by the environment around her. By what we say, by what we do not say, how we react, how we judge, and whether we make it safe for women to tell the truth about their bodies. In the next episode, we will talk about what happens after diagnosis, the role of community in healing, and how the women around us can either deepen our silence or help us break it. I'm Maha Jouini, and this is CHIFAA Podcast.